This was a highly visible and anxiety-provoking situation. How did this start for you? What was your first awareness of this, and how quickly did you get drawn into it as the CEO of our hospital? By the way, we've treated, I think, more Ebola patients here than any place else in the U.S.
I still believe that's correct.
That's correct,
Yeah.
So we became something of a center, and so that visibility was there. And of course, the other outcome, fortunately, was that you were incredibly successful at this. But that didn't occur randomly, so that's the story. What was this like on your end?
Well, honestly, the whole story really begins about 12 years ago with the medical director of our serious communicable disease unit, Dr. Bruce Ribner, received a grant from the CDC. And Bruce and I have reminisced recently about that grant. He came to my office 12 years ago. Long story short, the CDC wanted to provide some seed money to the hospital to help develop the infrastructure that resulted in this serious communicable disease unit. So, and they had practiced any number of times annually to take on patients with a serious communicable disease. But the specific situation, this is sort of like a almost a slow motion event in my recollection. We, the medical and nursing administrative leadership of the hospital, had been watching TV like the rest of the world, and we saw the face of this Dr. Kent Brantley on virtually every news program for a week. And we had been sort of following his deteriorating health. We knew that we had been practicing for this. And the Sunday, actually, I was in a conversation with, a conversation with a couple of folks the Sunday before we got our first patient. And a couple of us said, we'll ask ourselves, do you think we will end up with this patient? That was a conversation on a Sunday. On a Wednesday morning, Dr. Bruce Ribner walks in, didn't ask permission. He announced in his own wonderful way that he had accepted the transfer of this patient, which was exactly what he was supposed to do. So it was sort of a rolling crisis. We had forewarning, unlike an earthquake, which happens. This we had actually about 72 hours to really dig in. It's an enormous amount of work. First meeting, let's take care of the patient, clinical leaders. Second meeting was all about managing the message and managing the media, internal communications, external communications. If we misstepped on either communication efforts, the outcome could have been frankly disastrous or less than ideal for Emory, for the community.
Right, yeah. Well, and it appears to me that you guys did this as flawlessly as possible, because I both am on campus, so I was expecting perhaps there'd be some backlash, that we're taking on this risk and putting the community and the university at risk. And then I live in the community right next to the hospital, and I was really expecting it there, the Druid Hills community, and people saying, what are these guys doing, taking on a risk like this and putting us all at risk? And literally, I did not hear one dissenting voice in that time.